all misplace our keys from time to time. Forgetting small things is a normal part of getting older, but Alzheimer's disease is something different. It's a physical condition that attacks the brain in a very specific, deliberate way. To understand how it works, think of your memory like a tall bookshelf. Down on the bottom shelf, you have heavy, sturdy encyclopedias. These are your oldest memories and physical skills, things like knowing how to ride a bike or the layout of your childhood home. They are locked firmly in place. Up on the very top shelf, you have lightweight paperbacks. These are your newest memories, what you ate for breakfast today or a phone number someone just told you. Deep inside the brain, a structure called the hippocampus acts like a librarian, keeping these books organized. Alzheimer's damages this area first, effectively shaking the bookshelf from the top down. As it wobbles, those new, flimsy paperbacks fall right to the floor, while the heavy books at the bottom stay put. This is why families often see a confusing pattern. A loved one might remember a story from 50 years ago with perfect clarity, but have no memory of a conversation that happened 10 minutes ago. Recognizing this uneven pattern of memory loss is the essential first step. Catching the disease while only the top shelf is shaking gives families the best chance to protect what remains. The bookshelf doesn't usually collapse overnight. This is a slow process following a predictable path over many years. The timeline begins with a preclinical stage. Damage starts secretly. The person feels fine. Next is mild cognitive impairment. Top shelf paperbacks drop. They need reminders but stay independent. Finally, dementia. Shaking hits lower shelves. Memory loss interrupts basic tasks. Figuring exactly where a person sits on this timeline is the doctor's most important task, because that location determines what help is actually available. To find out why the bookshelf is starting to wobble, doctors look at a patient's life from several different angles at once. The first step is talking with the family. A spouse or adult child will often notice those dropped paperbacks long before the person experiencing the memory loss does. This happens because the disease often creates a physical blind spot. A person might honestly believe their memory is fine, simply because their brain has lost the ability to notice its own mistakes. Doctors also use cognitive puzzles. These aren't just memory tests. They measure how the brain handles complex tasks and reasoning to see if the shaking has spread to other areas. This MRI shows a full, healthy brain on the left, compared to an Alzheimer's brain on the right. Doctors use these images to look for noticeable shrinkage in the brain's anatomy, which confirms the physical toll of the disease. Finally, they use specialized scans or fluid tests to look for microscopic protein buildup. These are the physical termites damaging the brain's internal wiring. By combining these scans with the family's report and the cognitive puzzles, doctors no longer have to guess. They see the proof in real time. In the past, getting an accurate diagnosis was mostly about planning for the future, but today it is the essential first step to starting a new type of treatment. The FDA has recently approved groundbreaking new therapies that change how the disease is managed. For decades, medications just masked symptoms. New treatments actually scrub away the protein buildup, slowing the disease's progress. However, these medicines only work during the earliest stages. Once the damage moves too far down the bookshelf, the treatment can't do its job. This is why it's so important not to hide the early signs. If you notice those first few paperbacks falling, don't wait. Seek a medical evaluation as soon as possible. A diagnosis is no longer just a label to fear. When it's caught early, it's a map that gives families the power to fight back and buy more time together.